Hello there, my name's Caroline Brown, and those of you who saw my last film about our mental health records will know that I work in the University Archives. Here I am in the archives with Bobby. You'll meet Bobby in my next film, but I wanted to start off by showing you the archives. We really miss the archives, we miss the information in them, and we miss the difference that they can make to people's lives. And so in this film, I'm going to tell you a little bit about how we use our mental health records. One of the things that we spend a lot of our time doing is contributing to learning and teaching. The mental health records are used by history students, but also by students in education and social work, in medicine, and as you can see here, in nursing. We can learn from the past. Obviously, we can see what happened in the past and how we can make things better now. We can also look back to the good things that were in the past that can maybe inform our decisions about today. And in some senses, whether or not the past was better or worse, I think using archives gives us a different perspective. It gives us a context in which to discuss perhaps difficult issues today. So, for example, these mental health nursing students were given the space to reflect on current practice. We looked at those records of seclusion and restraint that I showed you last time, and we're able to have conversations about restraint today. And it's not just students who use the records like this, healthcare professionals do too. This is a tweet from the NHS Tayside Quality Improvement Lead, who came to the archives and used the records there to make films about mental health nursing. And for me, the archives is all about understanding where we came from. And I think NHS Tayside can perhaps look at the archives and think about how the organisation has got to where it is today. And it's that looking back and finding out where we came from that is so attractive for people who do family history. And family history inquiries are one of the largest amount of inquiries that we get, particularly in relation to the asylum records, because there's a huge amount of information about individuals in them. And I think family history is popular partly because it's a detective story, but also because it gives people a sense of understanding of who they are, and it becomes part of their identity. It reinforces their identity. And I think that's the same for communities and for cities like Dundee, particularly as the past is acknowledged as being very much part of Dundee's identity today. And we have a lot of information about local history in our collections, and you can see here some of the photographs that are in the Overgate, the main shopping centre today. Because archives are, of course, about memories. They're about prompting memories, they're about reinforcing memories, and they're about creating memories that can be passed through generations. This is a reminiscence project that my colleague Jan and Sharon did with the Boomerang Community Group. And reminiscing is such a tonic sometimes to people, but also perhaps at a deeper level it leads to a sense of empathy and a sense of community. And by interacting with archives, people are allowed to have space to think about themselves and where they've come from. So I'm going to tell you about a project now that touches on some of these points that I've already made. This was a project with Dundee Healthy Minds Network and with the School of Nursing here at Dundee. And we invited some mental health service users into the archives to look at our asylum records. Now, these people had never really thought about archives before. They'd very rarely come into the university, and they certainly didn't think that we'd have anything that would be useful to them. But this is one of the reactions that we had. And for me personally, and for my colleagues, working with the mental health service users was fantastic. It was such a positive experience. We were able to look back at stories of people that are represented in the archives. Stories, for example, of Edith Swankie, who the case notes tell us was 14 years old when she went into an asylum. She was a mill worker and she had symptoms of hypomania. And we can follow her story through the archives. And eventually, at the beginning of the 20th century, her mother took her out of the archive. And I think her story really resonated with all of us, particularly the mental health service users who could look back and see how people were treated in the past. But we also found out that Edith Swanke actually went on to get married, gave birth to a son, and she died in Dundee Royal Infirmary in 1955, and there's no evidence that she had any other mental health issues. But the fact that this was a real person who was represented in the archives that we could think about today was really important to all of us. And it helped the people who were participating in our project understand how important their own stories were. Now, Edith didn't have a voice in the archive. Other people were writing about her. So one of the things that we hope will come from this project that the participants will actually give voice to their feelings, to talk about their experiences, and we'll put those in the archive so that future generations can understand. And that's partly because when they were looking at the archive records, the information in there about treatment really resonated with them. Obviously, some of what happened in the past was bad, that we would not want to repeat that today, but they saw much that was encouraging, much that they felt should be applied in today's environment. This is a very dry, in some respects, report from Sunnyside Asylum from 1894. But some of the care that was being recommended and that was being described really touched the participants in our project. So, for example, they say that it's better to have a bright and cheerful aspect amongst the patient in the wards rather than gloomy, bare and comfortless rooms. And they talk about the constant supervision of the medical officers, the kindly personal dealing with the patients, the judicious gratification of individual tastes, the consideration of special habits, the entire absence of seclusion, the free exercise in the open air, and the abundance of good food. All things that they would, and we would all very much recommend, happened in mental health service care today. So the project for us was so positive. It gave people who wouldn't normally access archives a chance to look at them and a chance for us all to talk about what is a really important issue today, which is mental health well-being. And this is some of the feedback that we had, feedback around that idea of learning from the past, how some things in the past might seem barbaric and cruel, but there again, our descendants may feel the same way about the way we treat mental health today, and about how that experience of touching and holding and working with archives can give you a real buzz and can help people feel better and more positive than they have in a long time. It's thinking about how to make improvements to mental health services today. We need to look back through the years and compare notes. And finally, it's valuing stories. One of the participants said, learning about Edith Swanke showed the value of stories. It has helped me consider my own history of my struggles with mental health. So that's partly why me and my colleagues feel so privileged to use archive. It's because we're preserving memory. It's because the archives are helping people with their sense of identity and their understanding of communities. But it also is giving us space to think about difficult issues, but also hopefully helping with mental health and well-being throughout all of our communities. So thank you for listening, and we'll be doing another one of these very shortly.